তোমার না ক্লাস?
Hello, I am Dr. Vishwas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, I am Oli Robinson, 75 years.
Nice to meet you. How can I address you?
Well, you can tell me Oli.
Okay, Mr. Oli, I have got a letter from your GP saying that you have history of racing and pacing of your hearts for last 2 months. Is it right?
Yes, doctor.
So I am going to take detailed history and all the information during our discussion will remain confidential. So is that okay for you?
Yes.
So can you please tell me in more details what is happening with you?
Well, actually, doctor, there are some problems with my heartbeat, I think, doctor. Okay. For the last 2 months, I have a feeling that there have been some problem with my heartbeat. Sometimes it comes and goes. Actually, I feel that there is some. I can feel the heartbeat. Okay, it's fast, and before that heartbeat starts, I also feel that there is some dizziness. Okay, I feel that I will fall down. However, I have never fallen down or I have never lost consciousness, but I also feel dizziness, and these episodes have uh, have been coming more frequently recently. Okay, and so I'm a bit afraid what's going on, why this fast heartbeat comes. Okay, and so and also at that time I also feel at times some lightheadedness. Okay, I feel that it's the whole surroundings are light. Okay, and so these are bothering me, doctor. So what can be the cause? I'm at a loss.
Okay, let us find out what's happening with you, and I'm sorry to hear your condition. You said that you feel dizziness. Can you please tell me that what do you mean by dizziness?
Well, dizziness, I mean that okay, that I feel that I might fall down, I might lose my consciousness. I have that feeling. Okay, and even I feel that I feel that I feel light in my head. Okay, light means I may feel that I've lost weight. I'm very light now. Okay, so I have this feeling. So this is what I mean.
Okay, and except that before starting your uh, racing and pacing of your heart, do you feel any excessive sweating,
No, I haven't noticed that.
any feeling of hot, or any flushing?
No.
Just you feel the dizziness. And when
Yes.
the symptom starts, can you please tell me that how you feel the heartbeat? Can you show me by tapping with your finger?
Yes. Yes. Well, actually, can you hear me? Okay, that's like that. Okay, okay. Can you hear it?
Is it regular or irregular? What do you think?
I think it's regular. It's fast.
Regular and fast.
Yes.
Okay. And for how long it persists?
I think for 10 to 20 minutes.
10 to 20 minutes. Okay. And
Yes, I haven't counted, but I think it might be like that. I become normal again after 5-10 minutes, like that.
okay. And during the symptom, do you feel any other abnormalities like pounding in your neck,
No, I haven't noticed.
any chest pain?
Well, not chest pain, doctor. I don't think, but yes, it's true that I have some issues with my lung. Okay, with my chest. I have been I have been, well, what you know that I have been a patient of asbestosis. Okay, so sometimes I feel a bit shortness or sometimes a mild chest pain. Okay,
And any shortness of breath during your symptom, like during the racing and
no,
pacing
no,
of your heart?
no, no, that's different. That's different, I think.
Do you feel that you are going to fall down during your symptoms, or you are going to lose your consciousness, or have you ever lost consciousness?
I have never lost consciousness, doctor, but I have some feeling that I might lose consciousness. I might have to sit down. Okay, and also at times I feel some lightheadedness. That's all.
Any shakiness of your body have you noticed?
No, no,
And after the symptoms resolve, do you feel any after effect like any dizziness, any excessive sleepiness, any weakness,
no, no.
and any increased water output after the episode?
No, doctor, I have noticed.
And during the symptom, have you ever got any other problem like any excessive sweating, any feeling of hunger,
No, doctor, I have noticed.
any type of that you are worried like this?
No, no, no. Quite normal, doctor.
And how frequently do you feel these episodes?
Well, when it started 2 months back, I think I felt this episode 3 to 4 times. But the last month, I think it has been to 7 to 8 times. I felt this type of episode.
Have you noticed anything that makes your symptom worse?
No, I haven't noticed, doctor.
Anything that makes your symptom better?
No, I haven't noticed.
And how severe is this condition? How is it affecting your life?
It's not that much severe, doctor. Okay, I cannot just specify that it's very much severe. It's not like that, but it's bothering me. And since I'm aged now, 75 years old, I'm a bit concerned what's going on. And actually, I should tell you or not. I should tell you. I think I have some heart issues also. Previous, I had some one heart attack, and okay, so that's also a bit. I'm a bit nervous about it since I had a heart attack previously, and also I have asbestosis. I told you, and last 3 years ago or 2 years ago, I also had severe headache. Okay, and some problem in my vision, and doctor told me that it's a problem with my vessels, and he gave me steroid tablet for that. So I have been through these blood disorders, through this vessel disorders. So I'm worried.
I'm sorry to hear that. And when did you get your heart attack?
It was around 6 years back.
Are you on any medication for that?
Yes, doctor. I have been on some blood thinning medication, like I think aspirin, and also I have been some beta blocker. What you tell, I think it's beta blocker, and also I take medication for my blood cholesterol level. Okay, and since I told you that I had some problem with my blood vessel 2 years back. They have given me steroid, and they told me that I need some protection for my bone, and that's why I also take some calcium tablets and another tablet. I can't name it.
Do you take your medication regularly?
Yes, doctor. More or less regularly, I take this.
What about your that is called beta blocker? Do you take that regularly?
Doctor, yes, I think I take this regularly. But one thing is that actually I am getting old day by day. So I usually don't like to go to my heart doctor frequently as before. Okay. Previously, I used to go every year, okay, or every 6 months to have a checkup. But now I feel that, okay, I don't feel going so much. So I last visited him 1.5 years.
Have you noticed that when you feel the symptoms, do you what do you do during that time? Like any specific activity or
No, doctor, I haven't noticed that specifically. It just comes all on a sudden and goes also all on a sudden. And but sometimes is that after I want to tell you that at times I also feel that my heart is slowing down a bit. That is also something that I should tell you. That sometimes like I feel that it's going fast, it's a regular beat, okay. But at times I also feel that it's slowing down a bit, my heart.
okay? And do you have any problem in your vision?
Not now.
How about your weight?
I think it's quite good, doctor. I don't think it's within. I think it's within normal range.
And any rash or any hair in your body?
No,
Any hot or cold preferences?
no,
Any joint pain?
no.
Any how about your bowel habit?
It's quite good, doctor.
And you had this mentioned that heart attack and headache issue and asbestosis. Except those, do you have any other medical condition that I should be aware of?
No, doctor, I don't think so. But I have some problem with my blood pressure previously, and for that they have given me AC inhibitor, and it's quite what you told, AC inhibitor, I think. And after since taking that, my pressure is actually under control. I'm happy with that.
And have you got any changes in your dose recently?
No, no, it's been the same.
Okay. And do you take any water counter medication?
No,
Any herbal products?
no,
Any allergy to any medication do you have?
no, doctor.
Any of your family member have this type of condition or any other condition?
Well, I think my mother had a heart attack at 65 years of age. That's all.
I'm sorry to hear that. And can you tell me, can I ask you a few more personal questions?
Yes, of course.
Do you smoke cigarette?
I used to smoke cigarette 20, but I gave up 20 years.
Do you drink alcohol?
No.
Okay. And what do you do for living?
Well, I do nothing now. I'm an old person. I just stay at home.
Do you need any support from us, any social support or economic support?
I think, doctor, I'm well supported by my children and also by the state.
And may I know that when you have been diagnosed with asbestosis and are you on regular follow-up?
Yes, I have been going to my chest doctor every 1 year. Okay, and they also helped me getting some compensation for my lung condition, chest condition. So I'm happy with that, and I don't have usually have that much breathlessness now.
Have you noticed any swelling in your legs?
No,
How many pillows do you use at night?
one pillow, doctor.
Okay. So I am. May I know that? Do you want to add anything at this point? 2 minutes
No,
remaining.
doctor. I just want to know what's going on, what's happening, and I have heard that there is a heart issue called atrial fibrillation, where this palpitation, which is a very sinister thing. So is it right?
Actually, as I have taken your history and I need to examine you, then I could give you the best explanation.
Okay.
As you have got this symptom that you have sometimes low heartbeat and sometimes high heartbeat, we think that your where the electrical activity of the heart is maintained, it is not working properly. So it is a possibility that it is sometimes doing making some fasting heart rates and sometimes making some slow heart rate, and so that you are feeling this condition. And we refer it to the called sick sinus syndrome. Have you ever heard of it?
No, doctor. What's this? Is it very dangerous?
Actually, with proper management, proper treatment, it is a controllable condition. And for this, we need to run some blood tests, some imaging test of your heart, and also some electrical tracing of your heart. And after that, we will need to give you some device to control your heart rate. But we are going to assess you first, and after that, we are going to give you this. Options that what is better with you. And I think in the meantime, uh, you may be on observation as you are having frequently these symptoms. So this may be somewhat serious.
Okay. Okay, doctor. All right.
Do
So
you have
thank you,
any other
doctor.
question?
Well, actually, I'm a bit worried because I have to go by myself to home. So now you're telling that I have to be under observation. So I don't know how long I have to stay here. So I'm a bit worried.
Yeah. Time off. We will do it as soon as possible, and we will get our advice from the heart doctors, and they will be able to give you the better management. And we are observing you, and if you have any other issue, then we can help you on our from our hospital, that we can contact your family, and also we can arrange your transport if you like.
Okay. Thank you, doctor.
Thank you.
Yeah. So what do you think is the case of?
For this gentleman, my differentials are sick sinus syndrome. Then I will also consider some atrial fibrillation. Then I will also consider ventricular tachycardia. Yes,
Mhm.
yes, cannot remember.
Okay. So how will you investigate the patient?
I will go for the baseline investigations, and except those, I will go for the ECG, echocardiogram, and chest X-ray. Then 24-hour Holter monitoring.
Okay. And what can be the management in this patient regarding that he had a previous heart attack?
Okay, for this gentleman, as he has sometimes tachycardia and sometimes bradycardia. For this gentleman, I think medical management would be implantable cardioverter defibrillator.
Okay. Well, do you think that a permanent pacemaker can be a option here? Is it it may be important since he had a previous history of heart attack?
Yes, I think implantable cardioverter defibrillator would be more better option.
Okay. Okay. Thank you, doctor. Thanks a lot. It was a very good experience talking with you. Okay. So I think that you did really well. You pulled out the causes. You ruled out the causes by asking some important questions, actually, like for supraventricular tachycardia, that whether there is any pounding in the neck or increased urination at night. And for ventricular tachycardia, you also ruled out by telling that, okay, whether any loss of consciousness. These are important issues. However, when you asked, you could have asked some more things, that okay, you asked that whether it's improved by anything or deteriorates by anything, but I think you can be more specific, that whether it improves by uh, breath holding or not. Okay, so these questions I think might have been asked, because valsalva maneuver can uh, improve supraventricular tachycardia. Okay, I think might be asked, this might have been asked. And another thing is that I told that I had a heart attack 6 years back. Okay. Hmm. So 6 to 7 years back, at that time you actually asked about the medications, but you should have also asked about what was done, whether any intervention was done or not. Okay. Huh. Any PCI or anything was done or not, and if done, what about the present issues? Okay. Have I ever been to any doctor about my present condition of that intervention or not? Okay. Is there any fever, color change, or any bleeding? So any infective endocarditis is present or not? That should have been ruled out, I think. And also, uh, these were issues, I think. Otherwise, I think it was quite okay. And another thing is that you didn't ask about caffeine and caffeine intake. Okay, I
Yes,
think
yes, yes.
caffeine intake.
This is the thing
Okay,
that I remember last.
okay, I think caffeine intake could have been asked. That although he is an aged person, it's not likely, but I think it should have been asked about the caffeine intake. And otherwise, I think it's quite good, I think. And pre-syncopal episodes usually occur bradyarrhythmia, as long as I know. So this is actually a pointer to that, I think. Okay. That pre-syncopal attacks of dizziness, it might be associated with bradyarrhythmia also. So that is the thing. And you actually excluded other things nice, like hyperthyroidism, hypoglycemia. Okay, but I think you could have also asked about any flushing, any intermittent flushing, intermittent headache, intermittent, that comes and goes, to exclude pheochromocytoma, though all unlikely, but you could have asked. And you ruled out the anxiety issues very well, and other things were very well, and I think it was nice. Do you want to add anything?
Can it be a Stokes-Adams syndrome?
Stokes-Adams syndrome. Well, in Stokes-Adams syndrome, I think pre-syncopal episode is good. Sudden loss of consciousness may also be present, but this type of fast breathing, fast heartbeat, I think it's a bit rare. I think, I don't. You can also help me. I am not sure about it. What do you can also add? I'm not sure that whether Stokes-Adams syndrome. I think in Stokes-Adams syndrome, he will tell that I have some missed beat. I have some. I think that my heartbeat is missing. Okay, I think these issues will be more important, and I think he might also tell about any heart issues, previous heart attack also. Okay, so and it's also important to ask about what interventions were done. Okay, I think. But Stokes-Adams, I don't know. I think I don't think, given the symptoms, it's very likely.
Okay, and
What do you think?
can it be due to
Can
any
it be?
electrolyte imbalance? Or can it be a
Yes, it can.
presentation of
Yes, yes,
long QT
yes.
syndrome?
It can be electrolyte imbalance. Well, you actually should also have asked that. Did you had any episodes of fever before that onset? Okay, you could have specifically asked that, because long QT syndrome, although it's not, he's an aged person, but yes, you know that it at any type of in many electrolyte imbalance, this can cause. Okay, or what antibiotic, even ciprofloxacin can induce this thing, erythromycin can induce this thing. Okay, so just before that episode, any diarrhea, any history of fever, okay, I think this could have been asked to exclude long QT syndrome. I think vomiting, diarrhea, this could have also been asked, I think.
Okay.
So anything more?
No, I cannot remember.
Okay, I think it's quite done now. Okay, so thank you. Okay.